Right, we're on. Hold on, let me start this. Yes, you can go on, Ileana.
Yeah, I can begin.
Yes, I'd like to welcome you all to the second day of what makes homeopathy special. I'd like to introduce to you Ileana. She's going to be talking about what has made homeopathy special for her.
Yes.
So over to you, Ileana.
Hmm? So I can begin, yes?
Yes, yes.
Uh, okay, I will get to my slides. So hello, everybody. I'm very glad to meet you. And I would like to thank very much the organizers, to I Love Homeopathy, special thanks, and to Genoveva Georgieva, who has invited me today to speak. And I think this is a very good initiative. I welcome it, and I hope it will be continued um, if people, of course, like these presentations. I am a medical doctor. I'm also a practicing allopathic medicine, and this is physical medicine and rehabilitation, my allopathic specialty. And since 1996, approximately, I am practicing also homeopathy. And I think that indeed homeopathy is very special. I fell in love with homeopathy from the first time when I saw how it works. Um, it happened that I needed it in my family. I had to treat somebody who had very little hope to survive. Homeopathy indeed was of great help in 1992. And then I was very puzzled by the power and efficiency of homeopathy. And I started to learn this wonderful system of treatment. And until nowadays, I'm still very enthusiastic about it. And I'm really very happy that I had the chance to discover this beautiful medical system and art. So I forgot to tell you maybe that I'm from Romania. I'm also now, since 2 years ago, the president of the Romanian Society of Homeopathy. And we are trying to do our best to make homeopathy an important system of medicine in our country. So now I would like to share you some thoughts and some ideas about homeopathic treatment. Is somebody speaking, asking me something? Because I am hearing something. I don't know. I heard a voice. Or it was just maybe some mistake. Okay, so I will tell you, I would like today to speak about homeopathic treatment in acute respiratory diseases. I chose this subject because I consider it very important nowadays, considering the problems we face in all countries with the pandemic of COVID. And so acute respiratory diseases, I think, are very important for all of us, especially severe ones. So I would like to remind, first of all, some theoretical issues, not very many because there is very little time to speak. So about acute respiratory diseases, how we make prescriptions, what is the problem we face when we treat such type of diseases. The problem is that our prescription must be very precise and very quick, I should say, quick and precise, because in any acute disease, the pathology can aggravate if we do not have the right answer to the problem. The problem with my slides is that they somehow disappear. Okay, what is important from this acute point of view of the pathology is that, as I said, it is a process which tends to finish more or less quickly. It's not too much time to decide what to do, like it happens in chronic diseases. And here I show you in this slide the aphorin 72 from the organon, which says exactly this, that always in a moderate time, more or less quickly, the morbid process is evolving in an acute disease, because either it terminates in death or in recovery, but everything happens very quickly. And the underlying problem is the explosion of latent psora. In fact, it's this miasm which is acting in an acute disease. So, how should we take the case in acute respiratory diseases? Also, Master Hahnemann is telling us in aphoris 99 that in the acute cases, it should be very easy for us to take a case, because all the symptoms are very fresh and very striking in the mind of the patient. So he almost spontaneously tells us everything about his disease. But also we as medical doctors can see and examine the patient so that we see immediately the symptoms and the signs of the disease which are acute. Now, what could be the problem in these acute situations is that sometimes we are doing the wrong thing, meaning it's simple but it's wrong, that we tend to prescribe on one or two keynotes. Many homeopaths are looking for some striking keynotes, and they do not think so much of the totality of the picture in an acute situation. But actually, we have also a totality in an acute case, which is the acute totality, consisting in mental, emotional, general, and local symptoms, but in that acute present situation. And so repertorization is also very important in any acute case, like in all the cases we usually treat by homeopathy. So we have a local totality, which consists usually of complete symptoms, like Bönninghausen has called them, complete symptom, with localization, sensation, modalities, concomitances, and if we have the possibility, we should use also the causality. And there is also a general totality, very important, with changes in the physical symptoms, general physical symptoms like appetite, thirst, and thermic reactions, and changes of the mental, emotional symptoms, meaning, for instance, fear or anxiety, but not the fear that the person experienced many years ago. Maybe there were some fears, let's say, in the childhood of the patient. These are not so important in an acute situation, but we should look for a fear or an anxiety in that particular situation. Of course, the clinical examination is also very important in an acute disease. We should take in consideration general state, tongue, the aspect of the tongue, the eyes, skin, all these things I have put in this slide. And it's important that these signs can be usually found in the repertory also, yes, like repertorial rubrics. So in our analysis, they can find their place. An example here, in the repertory, for instance, if we saw that the tongue is white during an acute with fever, we can use this rubric here, mouth discoloration, tongue white during fever. Or even a sign which seems not a very homeopathic one, but it's important for the physical examination. Wheezing. If we find in our patient a wheezing, there is a rubric wheezing, or we have maybe a noise, pulmonary noise like rattling, we can use this rubric. Although these rubrics are covering very many remedies. And what I would like to underline is that in an acute case, especially if it is a severe case with an advanced pathology, it's important also not to forget the pathology, the organ which is affected, and all that we can say about the pathology. I saw these things explained recently in a webinar by Dr. Borkar, that in advanced pathologies, it's very important to take into consideration also pathology, not only symptoms. Now let's go to a paper case, which is of course more interesting than all these theoretic aspects. Recently in January this year, I treated a patient. She is a student, 21 years old. She came from Malaysia, where she was in holidays, and she said at that time in January that 10 days ago she started to have a cold. She believed that this was because of the air conditioning, because being in a hot place, there was a lot of air conditioning there, and so she got a cold. So that she experienced at the moment of consultation difficulty in breathing. Even now she has the sensation of pressure in chest. Now this was at the moment of consultation, with a difficulty in inspiration and a dry cough. I looked for some modalities. As I said, it's important to look for the local totality, so we can find, it's important to see the complete symptom, and we are looking for modalities. Cough was an important symptom, and it was ameliorated sitting, especially if bending forward. Also, that difficulty in respiration had some modalities. Aggravation by walking, ascending stairs, by physical exertion in general, by laughing, and if exposed to cold air. Then, of course, I asked a few things about her family history. I found out that the grandmother had tuberculosis, her personal history, bronchial asthma in childhood, and colds, getting easily colds in winter. About some mental symptoms, so I look also for the general picture with mental emotional symptoms. She was anxious about recovery because already there were many days from the moment she started to have this problem, and she was thinking, what is happening? Why is she not recovering? Also, she felt tired. Some general symptoms I found about appetite. Appetite has diminished, and it was even worse that she had an aggravation from the smell of cooked food, so she couldn't eat cooked food. Then she was a chilly person with a lack of vital heat. About perspiration, I found out that it was normal. And on auscultation, after the examination, I heard the sibilant noises. She didn't have a wheezing. You couldn't hear from the distance a wheezing, but on auscultation, there was indeed, there were some sibilant noises. So what do you think about the remedy she needed? Actually, there is not too much time to put questions and to look for answers. So I will answer you from the beginning. We have a repertorization. I don't know how big is the screen and if you can notice, but all the symptoms, I underlined the first remedy when I clicked on the first remedy, which was Arsenicum album. You could see immediately all the symptoms belonging, they are green here all. So they all belong to Arsenicum album. So beginning with her despair of recovery, and then we have this sensitivity to cooked food. We have also the asthmatic respiration, the modality bending forward ameliorates. We have laughing aggravates and so on. All the symptoms I took belong to Arsenicum album. So I thought, yes, this is a good choice. And I gave her Arsenicum album, CH200, 3 times a day, being in a subacute situation. I chose to give 3 times a day. In water, I usually prefer to give the remedy in water, taking into consideration that in the 6th edition and even from the 5th edition of the Organon, Hahnemann recommended to give remedies in water if we can. I mean, not if we can, he recommended to give in water, but nowadays if we can, especially if we give more days a remedy, I consider it very important to give the remedy in water because you make some succussions before every administration, and this makes the possibility of having an aggravation to decrease very much. So I gave in water the remedy for 3 days, then with the indication to take more seldom the remedy, actually twice a day. And of course, I was in touch with the patient by telephone after the consultation. In case something happened, she was supposed to announce me immediately. So on 28th of January, she called me and she said, okay, now I'm feeling much ameliorated. The breathing was almost normal. She had more energy, could do her work in the house. Before it was difficult for her to have the energy to do some work. She could eat more and had no problem with the odor of cooked food. So I considered it a very important amelioration, but I didn't stop the remedy considering it was an acute problem and still needed treatment. So I recommended 1 dose daily in the next days. Now on 3rd of February, she came to my office. She was indeed better. Still a few sibilants could be heard on auscultation. And now I consider that because of these sibilants were still present, the cure was not complete. I continued with arsenicum, same potency, but at 2 days interval for the next days. So that on 9th of February, she was asymptomatic, she was feeling very well. Yes, and the cure we could consider complete. But there was an unexpected continuation, as I say here, because after getting cured, on 16th of March, she calls me again, telling me that she's a contact with COVID-19. Her brother was infected with the virus, and this happened actually on 2nd of March when he apparently caught a simple, a common cold, but after a few days, actually on 16th of March, being tested because he became suspicious that he could have this disease, he found out he was infected with the new coronavirus. So she, being in the same house with her brother, was also tested, and in her case it was unconclusive, the test, but her brother was indeed confirmed, so that they were both put to quarantine in their own house. And in the beginning of the epidemic in our country, the patients were not hospitalized, but they were isolated at home, checked every day if they were at home, and in case of need, in case of an aggravation of a situation which needed some measures like hospitalization, they were supposed to call 112 and demand to go to the hospital. But they wanted to try to stay at home and to be treated only homeopathically. So at this date, 16th of March, as I told you, she called me. She explained about the situation. And at that moment, I said she had no symptoms. She was just contact with the disease. I decided that she should wait, not to take immediately another remedy or even arsenicum album to take again. There was no reason because she already took this remedy not many days ago, and it could have been that this remedy could be also preventive for her. We know that this remedy was announced to be a possible genus epidemicus for COVID. So I decided that she should wait. Now, after 4 days, she calls me again on telephone and she tells me she feels a slight difficulty in respiration, which is reminding her of the symptoms she already had in January and February. She couldn't explain what kind of sensation was this difficulty, but just that it resembled what she experienced before. And also now she complained of some dryness of the throat, but not very intense. Now repertorizing again, actually we have not too many symptoms, but I considered that the symptoms she has now belong again to Arsenicum album, so I decided to repeat Arsenicum album with this rhythm of 2 doses a day, considering that it was not a very intense pathology at that moment. So she began to take twice a day Arsenicum album. And the second day, 21st of March, as you see in the slide, respiration ameliorated by 70-80%. I asked her and she appreciated that 70-80% was ameliorated. There was still this dryness of the throat in the morning, which disappeared in the first hours of the day. I consider there is a very important amelioration, so I recommended now to take Arsenicum album, same potency, but only once a day. She continued to take the remedy, and we talked on telephone daily to check how she is feeling. And I would have wanted to tell her to stop more quickly the remedy, not to take so many days as she took. But she felt every morning that there was kind of difficulty in inspiration. And when she took the remedy in 10-15 minutes, this difficulty disappeared. And she was okay for the next 24 hours. So she continued to take Arsenicum till 13 of April daily. And she became completely free of symptoms on 13 of April. So she continued, of course, to stay isolated at home until she was tested. They demanded tested to be made again. Important was for her brother to be tested and to become negative. So on 23rd of April, they were tested by a medical team who came at home, and both were negative. As I explained you, she was not positive in the beginning, but her brother was positive. So on 23rd, it was okay. Another test was performed again, and finally they could get out from the quarantine on 25 of April. Now, as an observation, it is possible that my patient took too much time the remedy. I think she could have taken less days than she took, but it was okay. She didn't aggravate. And she took the remedy for 25 days until becoming completely asymptomatic. So she was cured in 25 days. Now, a few words about her brother also. I didn't put like a paper case, also his case, but I will explain you very quickly that in his case, he in the repertorization, which is very small here and you cannot see it, but it was important in his case. He had a dry cough, also dryness in the throat. Dryness was very intense, important symptom. So together with the other symptoms he had, also he had that very characteristic loss of smell and loss of taste, which I put also in the repertorization. So in his case, the remedy was bryonia. I gave him bryonia for the first 10 days. And then what happened very interesting is that he ate something which was a little bit altered, but he didn't realize. He ordered some food which was brought to his door. So from fast food, he ordered some hamburgers. And after eating this, he developed quite important symptoms of enterocolitis. And the enterocolitis symptoms were again of Arsenicum album. So I gave him to take hourly Arsenicum album, CH200, and he had to take for half of day Arsenicum album until he was okay with the problem of this enterocolitis. He had nausea, vomiting, and soft stools with pains in the abdomen. He got well after the remedy, and then making again a repertorization, I said to myself that maybe it's better that he continues with Arsenicum album after this episode. So he took Arsenicum album for the next days. And so in total, he was treated from 16th of March when I began with Bryonia, then 10 days with Bryonia, and until 7th of April, he took Arsenicum album, CH200, first 3 times a day, then 2 times a day. And he became asymptomatic on 7th of April. In total, a treatment which was of 23 days. Now, on 23rd of April, as I told you, he, together with his sister, was tested and became negative. So he stayed in the house until 2 tests consecutively were negative. But in fact, he was asymptomatic from the 7th of April, when very interesting is that also the taste and the smell came back. And this is the moment when I said, okay, he is cured, because also these symptoms disappeared. Here I show you the references I use for the theoretical part of the presentation. And because I knew that I have to speak only for half an hour, I thank you for your attention. I hope it was interesting to see 2 cases. One of them, surely it was of COVID-19. The second one, I think it was also, but it was not confirmed. And so we see that homeopathy can have very good results in this disease if it is especially a mild form. I'm sure other homeopaths have also maybe bigger experience in this situation. I treated from the family of these 2 brothers also other 3 persons, and they responded very well, mainly also to Arsenicum album, but not only to Arsenicum. It was for a while Arsenicum album, and also other remedies were used, like Rus toxicodendron and Gelsemium also I used in one of these cases. But I was very satisfied, and the patients also were very happy to get cured with homeopathy and not to go to the hospital. So this is it. I hope you enjoyed my small presentation, and I thank you again for the opportunity, for the possibility to talk to you today. And as I told you, I hope to meet you again maybe in future, and the other colleagues. Well, I do not see Dr. Kartik. He's there, or the other presenter. I don't know who is supposed to continue now. Kartik, are you hearing me? Maybe there is somebody who wants to put some questions. I think there is a chat here with a possibility of answering to questions, but I don't see you. I don't see the questions. Is anybody hearing? Dana, I see. Yeah,
Hello.
I think we're supposed to continue now the speech. Yes, you could put the slides.
Yes. How can I put the slides?
The slides are somewhere in the upper part on the right side. You see there slides. It's a button called slides.
Yeah.
And there
You
you
can see.
press on these slides. Then there is a button where
Share
it's
files.
upload files, and then you open. It's written there open, so you can open them. I have closed my slides so that you can put yours. I don't know if there are questions. I didn't see any questions here, but maybe the presentations were very clear and there is no need to ask anything. About my cases, until you begin, I want to say that they look very simple now, but in fact, at the moment when I took these cases, it was not so simple, and some parts of the cases were taken during the night. We discussed with the patients. I discussed with them at 12 o'clock in the night or at 1 o'clock. I told them to call me if there is some problem, and some of them indeed called me during the night. So I was in a very close contact with them by telephone. Otherwise, I consider it's not possible to follow such cases, to take cases and to give remedies, because it's an acute situation, and it's very important to see if there is an aggravation. What do? You have to give quickly either the same remedy or another remedy and to change the potency. So there were problems which here I didn't go very much to explain. But indeed, it was a very challenging situation, and I'm very happy that in the end everything was very well, and the patients were very satisfied. They even told on Facebook they were treated homeopathic, and they were really, really very grateful to homeopathy. So I finished my presentation, and
All right, Ileana. Thank you very much for that wonderful webinar.
yeah, thank you too again for inviting
So,
me.
so we hope to see you on more of these webinars soon.
Well, with pleasure. If you will invite me, I will come with pleasure.
Definitely, definitely. Thank you so much, Dr. Ileana. Dana, how are you doing?
I've got difficulties to upload the files for some
I think
reason.
you just
So
need to.
I'll probably share the screen.
Uh, if you go to screen, do you want to share the screen,
Yeah,
or
so
do you want to
you can
upload?
see the presentation. Can't
All
do
right,
that.
okay.
Is that
You
right?
go to start sharing the screen, which is an icon right on top, next to the camera icon.
And which one is the
Oh,
option?
okay. Now do you see? Now you've got the drawing board on.
Entire screen.
Yes, entire screen.
Right.
Yeah.
Right. Can you see it
Just
now?
wait for. Yes, I can see it now. Now you just have to expand that. Yeah.
Yes.
You just have to expand that point
First
and
of all, yeah. Hello, everyone. My name is Dana Routledge. I'm practicing in England as a homeopath for 10 years now. But I have patients from all over the world. And I do some public talks about homeopathy. I've done some lectures for medical students last year for NHS. And I'm very passionate about homeopathy. This lecture or talk is more for the patients. the general public to give some awareness about homeopathy. It is such a shame that I can't upload my presentation, but I'll try my best. I'm going to talk about case taking. What is case taking? What is the meaning of it? How important it is in homeopathy? What is to be a patient and a homeopath in this process? And then I'm going to present 5 cases. Hello? Can you hear me?
Yes, I can hear you, Dana.
Yes.
You,
Yeah,
you've
something
changed
happened.
the screen.
Sorry.
Yeah, you've changed the screen.
All right. Right, I'll go to the presentation now.
Yeah.
Right?
If you
So,
can just expand the screen so that you get a full screen, the PowerPoint. You go to a full screen. You can stop the show and then I think it goes to full screen. Yes, that's right. There you go.
is that all right? Is that all right?
No.
Right.
No, it's all right. I think you just carry on.
No, I think that's something else.
No, I think that's something else. You can. No,
Yes.
no, that's something else. So I think. Yeah.
Oh, yes,
Okay,
I
you got
see.
it now. Oh, yeah. All right. I think you can go on
All
like
right.
this. Yeah.
So what is case taken in homeopathy? That's the first contact with the patient, and that's the first information that we get from the patient and about the case. Can you hear me? Okay. Something happens to the sound.
Now you can just use your right arrow to move slides. Now.
Yes. So case
Yeah.
taking is our first interaction with the patient and collecting the information, which is verbal and non-verbal. And the non-verbal information about the patient we get through the way he walks, the body posture, the expression, the energy, the physical constitution. So this is the first impression. And homeopathy has got very specific way of case taking and asking questions. This is what we need to make the prescription. The consultation starts with the basic things about the patient, just simply naming the complaints. And after that, we start to ask more information to get full details and this specific information that we need to prescribe. And I gave this example here. If you just say, doctor, I've got a knee pain or arthritis or psoriasis, and a homeopath cannot prescribe on that because we don't prescribe on diagnosis. But what is important to us, we'll extend this and I will ask more questions. What kind of a pain is it? Can you describe it? When did it start? Is there anything that makes it worse or better? And then, does it extend to other parts? So we need to know all this information to prescribe. And when the patient answers all these questions, and we've got something like, this pain started 4 months ago when I went on holiday, and there was very strong icy winds, and it was raining all the time, and I got this pain. And it's worse in the morning when I wake up, but when I walk, it gets better. It's very painful on touch, and it's warm as well. But when I get a warm shower, I feel better. So this is a kind of information that we need in homeopathy, able to prescribe and get to a case. In homeopathy, there are, I think, in case taking 4 very important things. The first thing is observation, which is the non-verbal information from the patient that I've already mentioned. The second thing is listening very carefully to what the person has to say, filtering the information and listening. In order to prescribe, we also need very thorough exploration of the case or the person, because what we are interested in, that's the individual. In homeopathy, we say we treat individual with disease and not disease in individual, which means that when we see a person, when we have got the patient, we treat all the aspects of the individual, not just one. Yes, he comes with complaint, and we're trying to treat this complaint, but we also treat all aspects in individual, so he gets a better health, becomes stronger, and this way he can fight better with stress, with challenges in life. And so that's why we need to know more about every patient that comes. While treating complaints or simply disease in individual, that means that we are not interested in the individual. We only treat local complaints, which won't lead to any deep effect of homeopathy or long-lasting effect. It will lead to temporary improvement of the condition, but not a healing process, really. So that's very, very important. So when I'm saying thorough exploration of the case and exploring all aspects of human life, we ask questions. Sorry, what happened to the slides? So we ask about their relationship in the family, at work, about their energy. Just get to the slide. We're asking even about their dreams. Yes, what is important for us as homeopaths, taking a case, there are different approaches in taking cases. One is the classical approach, in which we are interested in all aspects of life. The other approach is the sensation method, in which they're also interested in the aspects of life, but what is more important is the experience, the subconscious and conscious experience of the person and the relation to the source. And there's a third approach, which I've mentioned, which is purely symptomatic and doesn't lead to major improvements in the condition. So we ask things about the sleep patterns. We need to know if the sleep is good, if the sleep is disturbed in any way, how many hours a person sleeps, is it refreshing, is it interrupts, does the people walk or talk during sleep, and then is it anxious, does he wake up in the middle of the night. We also like to know everything about the personal medical history, about the family diseases. They are very important because this is the genetic factors. You're interested in the energy or the vitality of the activity of the person, sensitivity, and it's very interesting because when we're taking a case, each case is strongly individual, it's very unique, and it's just simply always different. And sometimes we've got people that are very open. They will tell you everything you need to know and even more. And there are other people that come with very precise and detailed information. It's written on a notebook, very neat. They've got everything by date, by hour. medications, the names of the medications or the doctor. This is also very valuable information for us. There are other people, I think majority, that do not pay much attention to details. So when we ask them, they can't remember. But again, they might remember in the future some details, and when they come on the second, on the third consultation, they'll remember some details. For example, if you ask, you've got a patient with headache, then you ask, what's the headache like? Oh, it's unbearable, it's horrible. And when it's worse, is there anything that makes it better? Oh no, I don't know, it's horrible, it's just unbearable. So the people don't remember, but next time when she comes, she might say, I've actually noticed that when I look down, when I bend, I feel worse. And towards the end, I start sneezing, for example, or I start craving sour food. And then I really feel better when I open the window. I just can't breathe. So this kind of information is very valuable for us. Sensitivity of the patient and food preferences, what they like to eat. Are there any aversions? Do they have appetite? Body temperature and tolerance are also very important for us. Body elimination processes, that's also important. What are the stress factors? This means we are looking in the case for a causative factors that cause a disease, cause this disbalance in the person, and that's why we'd like to know what triggers them, because everyone reacts differently to different stimuli and with different proportion. So we'd like to know what the reactions of the person are towards different situations in life and what triggers problems. Relationships are very important as well, and sometimes we ask about dreams. This is very interesting. Dreams are very interesting because they're expression somehow of our subconscious, they're expression of ourself. So these are very important things. I would say that during a case taken, right, back where we are, it's very important for the homeopath to explain to the patient what homeopathy is, like basic things. What is homeopathy? How it works? This is very important. Also to explain how the remedies work, because that's our remedies are very specific in action. They don't resemble any other medicine. And people usually are used to the allopathic prescriptions in which medications are taken on daily basis with build-up effect. In homeopathy, we've got a different principle of how the remedy work, and they build effect over time. They develop their effect in time, but the homeopathic remedies are not meant to be taken for a long time. And after people stop taking their prescription, homeopathic prescription, the curative effect develops in time. So it's very important to tell our patients, to explain that, and to tell them not to self-prescribe, which I find very important. Many people tend to take on a daily basis for a long period. You've got difficulties understanding how homeopathy works. So our aim with homeopathy is for the person to remain stronger, because it depends on pathology and genetics, generally stronger to what he's been before the treatment. So we improve all aspects in this person, his health and well-being. And I will demonstrate you with some cases how it works. These are 5 cases. right? These are all cases of conditions that are considered incurable by the allopathic conventional medicine. The first one, I've got 2 cases of bipolar disorder, polycystic ovary. I've got multiple Hashimoto and multiple organ failure, and I do have one with panic attacks. So the first case is a woman, 38 years old, has a panic attack at big ovarian cyst. She's calling about acute complaint, big ovarian cyst, which is 6 centimeters. She's very frightened, she's in a big distress. The doctor recommends surgery straight away, but the patient is afraid and would like to avoid it if possible. She already had the surgery with hemorrhagic cyst a few years back, ruptured, and she doesn't want another surgery. She's put on hormonal therapy with Defeston because her period is delayed with 2 weeks. After the hormones, she starts taking the hormones. She develops violent panic attacks and terrors and depression. So at the moment, she's in distress. We've got only 3-4 days. That was on Thursday, so we had time until Monday to do something about the cyst before her hospital appointment. I gave her Lachesis 200C, remedy which is made of snake poison, which was indicated for the cyst, and after the remedy, she managed to sleep that night. Next day, she starts bleeding for a few days, and after her period, she went for her examination. The cyst shrinked smaller to 2.3 centimeters from 6 and does not require surgery anymore. It reduces further and disappears completely until the next period. So, but after this treatment, which was acute, I had to prescribe, but we saved the surgery, which is very important of how homeopathy works, not only in chronic conditions, but in acute. So now we are back to the chronic condition. We've got the panic attacks once again. Right, she suffered from panic attack. She's got history of suffering panic attack, and 7 years before this consultation, she had Graves' disease. She had bulging eyes and palpitations, panic attacks, intolerance to heat, and all that. So I've treated her with calcare, gentamicin, and the hormones went back to normal, and she fully recovered. And tuberculinum thing again, she fully recovered, and all the hormones, the thyroid hormones, are in norm. But now, what I can see in this case, she develops, what happens is she loses few close people, they die. And she develops extreme fear of death. She thinks she will die. Terrifying fear of death. Doesn't want to stay alone. She asks people to stay with her, especially overnight. Fear of the dark, and keeps the light on the night time. Doesn't go out much. She's very, very outgoing. But she gets vertigo and needs to lie down. Thyroid test is normal, so it's not from the thyroid this time, and all the blood tests are normal. This is a great disturbance of the nervous system caused from the fright and the shock that she experienced. So you can see the connection and the relation between the mind and the body, and how the mind triggers a disease. This is, as I said, very outgoing person, vivid, very communicative, but now she can't go out. Most of the time she feels very tired. I remembered from the previous take in a case 7 years ago that she's afraid of deep water, and she had fear of dogs. And I've prescribed stramonium with very good effect. She started to go out more and slowly recover. In the future, she might need a constitutional remedy, but she is all right for now. This is a case of a bipolar disorder and alcoholism. It's man, 60-year-old. It's a very complicated case because of the multi-substances abuse in the past and present, narcotics after he loses his wife and daughter 30 years ago. Very nice man, very kind, tall, strong moral principles, clever and self-aware. He suffers alcoholic addiction for years. When drinking alcohol, he is nagging, verbally very challenging, but never physically aggressive, and just irritating the others. And there's a lot of anger in him, which he expresses verbally. He has episodes of depression and mania, obviously. When it's depression, he doesn't come out of his room for days, has violent migraines and angry outbursts. During the episodes of mania, he's cheerful, optimistic, everything looks bright. He's on lithium, he takes lots of codeine as well for the pain. He loves to theorize, he's a philosophical type of a person, he likes to help people, kind, polite. He used to work as a social worker in the past, but for the last 20 years, cannot work because of the bipolar disorder. My first prescription is Ileana 1 mg, 2 doses in 2 days. After 2 months, I do a follow-up, and he has stopped drinking completely. He says he feels no pleasure anymore. The migraines are bad again. He says the bipolar complaints are the same. So my next prescription, after analyzing the case, is natrium uraticum 10 mg. Follow-up, there's a follow-up after another 6 weeks, and for the first time in 30 years, he says he had the courage to visit his wife and child graves. He had 1 episode of depression, but much shorter, only 2 days, and the anger has been under control. So we see in these cases are the things that were out of control coming under control, which is very good. He understands where the anger is coming from. He says for the first time in years, he's in love with someone. He feels like he wants to do more things, to travel, he's more lively. The migraines are still strong, but do not last for many days as before. Last follow-up I do with him is 3 months after he already has a girlfriend. He's got rare episodes, much milder. Migraines are rare. He's in control. He's aware what's going on. He sleeps better, less migraines. Yes, and I haven't heard from him since. He said he's reconstructing his house. He tidies up more because when I went for a consultation, the house was very untidy. Obviously, he didn't care much. And there's another case of bipolar disorder. This is a woman, 22-year-old. So she is diagnosed with bipolar disorder about 7 years ago. She's on medications. She only has manic episodes with no depressions. She's very clever. She knows a few languages, thinks and reacts very quickly. Her appearance seems a bit neglected, her clothes and everything. During manic episodes, she's very loud. She talks really loud. She's got very hurried and disconnected speech. You can hardly understand her. During manic episodes, she's exposing sexually herself with undressing, provocative language. She had some lack of sensitivity because her mother had died, and when she was talking about her, she expressed that she didn't like her much, and about other things, so she had kind of lack of sensitivity. Right, she didn't regret about it. Father is financially looking after her, but there is much tension there, so she lives with her auntie, who is very controlling and domineering. She is very competitive, could be very offensive, and even hit children during many episodes. Very good energy, talks loud. She was prescribed Hyoscyamus, because Hyoscyamus is a remedy which is very good for kind of shameless behavior, exposed sexuality. So this is very good for this kind of mania. So I prescribed Hyoscyamus LM1 to take for 15 days. Right, when she first came, that was during many episodes, her friends brought her to me, and she had this bird speech, and she sat on the floor on the consultation room, and she asked me and pulled me to sit with her on the floor. Right, that was it. And when I gave her the remedy, within half an hour, she became calmer. So we started straight away. She took this Hyoscyamus for 15 days. And on the first consultation, in 4 months, not 4 months, but after 4 months, the difference. She's on medications. She's much more relaxed. She had one episode and mild, her friends say. The friends say she's much better. She wears clean clothes, even wears makeup. She looks nice, says she's better. What happened? She was doing really well in homeopathy until they changed the psychiatrist, and psychiatrists changed her medications. After that, she had a relapse. And again, she started having some manic episodes. I managed to give her some more Hyoscyamus again to prescribe on her. So she started feeling better again. Right. So I gave it because the Garanti, who is very domineering, was against homeopathy in general. So she managed one time to come alone, and I gave her Hyoscyamus LM2 again because she wanted to get off medication or reduce them, but the auntie wouldn't allow it. So she started feeling better again. The medication is changed again because of the picture changing. And I prescribed belladonna this time. I haven't heard from her, but her friend said she's really doing well. She got married, she's got a child, and she's happy. What happened? She became more independent in life, and she married abroad. Now, with these bipolar cases, I would like you to see how we improve the quality of life of these people, because they can't live normal life with bipolar disorder. To what extent they can be normal, they can interact normally with people, they can get on with life and do what they want. I've noticed in bipolar cases, they're all different, very interesting, and I've noticed that there's always a conflict in the person that becomes or can't be resolved, which comes from either their nature or desire and needs in the society or family or religion or culture that puts pressure on them or something else. And when the problem cannot be resolved, it seems like the personality kind of splits to protect itself. Because we know in homeopathy that the body is wise and limits, the disease to the minimum, depending on the constitution and the genetics, with the minimal damage for the person. So this is kind of protection the body develops, as well as genetics, but also protection. And I think we are doing really well with bipolar conditions. This is a woman, 65. She's got multiple conditions, heart condition insufficiency, hypertension, Hashimoto, hernia, diabetes, and even arthritis. I didn't put that there. She's got, recently they've discovered that she's got hypertrophy of the thyroid gland, Hashimoto disease. The hormone is really, really high. And she's been hospitalized, and with medication goes down to 9.4, still very high. She's been hospitalized for the heart condition, palpitations. It starts 4 months ago, when this woman got sudden extreme weakness, palpitations, headache, especially after 9 in the evening, and when she lies down in bed. She fears she's going to die and her heart will stop. She can't walk and talk during palpitations. Feet and hands are icy cold. She's not thirsty, but when she drinks, prefers cold drinks. The problem starts with some quarrels in the family. I think they were over some property with relatives. The prescription is Aconite 30C. Aconite is really good remedy for sudden weakness, for sudden panic attacks with palpitations, especially in the evening, 9 o'clock. So I give her Aconite 30C for 3 days, and then I go up to Aconite 1M. After 2 months, she's better, she can breathe better, her general condition is improved, palpitations, lowered TSH, the thyroid hormone goes down to 6, then 4. She's got no fear of dying anymore. After a couple more months, she's calling with acute hernia, umbilical hernia, very prominent. The doctor wants surgery, but she doesn't. She's afraid. I can see the hernia is very prominent, is big, sticking out of the belly button. And now the prescription is Plumbum. Within 3-4 days, hernia goes back, disappears, so there's no surgery is required. We repeated Plumbum 1 more time, but she responded really well, and she's been in a good state of health for a while without any significant complaint. So this is a person with multiple conditions, 65-year-old, and she's doing really well. And this is the last case. This is a polycystic ovaries and thalassemia minor, which is anemia, Mediterranean anemia, and the woman is 35. She's with polycystic ovaries since teenage, and the doctors have told her she can't have children. The anemia is mild, and the periods are very irregular or missing. She didn't have any for the last 2 months before she called me. She's got premenstrual syndrome, very irritable and aggressive before period. She says as if I'm 2 different persons before and after. Very hungry. She's got lots of pain and takes painkillers. She's got very girlish, I would say, even baby face for her age. Yellow, pale skin. She likes pale, girly colors to wear. She's very reserved. She's got bursts out in predictable laugh and behavior, biting remarks alternating with being affectionate and caring. She seemed to have problem with the father for being very domineering in the family. She likes salad, fruit, vegetarian, likes cabbage, carrot. Prefers cold drinks. She's a chilly person. She likes to be busy. She's very active. She's got very active social life. As a tolerance, she likes to be in the middle, moderate temperature. She twisted her leg while skiing 7 years ago before the consultation, and she's got broken hamstring on the right leg. She still climbs though, but it hurts. Had many disappointments in love and suffers long time after it. 2 years ago, she had a relationship for 6-7 months, and since then, she still can't fully recover. She's very sensitive towards bad and tragic news, sympathetic, sometimes cannot even hear. She doesn't even want to hear about cruelties, about something sad happening. It's very hard for her. Works as a financial advisor for the Ministry of Finances. My first prescription for her was sepia because she's very active, because she's gets a bit aggressive, because she's got lots of hormonal problems. But sepia didn't work as expected. So on the follow-up after sepia, she is snappy more than usual, and that affects her relationship at work. People run away from her. She feels extremely tense from the workload and the stress. She says no remedy can help the pressure at work and feeling awful. She doesn't express her feelings and emotions. The only positive change after sepia was that she didn't have premenstrual syndrome. So I changed my prescription to Netmure because of her inappropriate expression of her feeling and the contradiction in her character. Nature Muriaticum is famous for their contradictions, let's say, especially when they like people, they might behave exactly the opposite. And I've changed the prescription, so the follow-up after Natpure 1M, depression, she's got depression at first few days. She's been aggressive for no reason for a few days. But then after 2-3 weeks, she notices a very positive change. At work, she's not bothered that much, and the tension there doesn't affect her really. She says, before I would feel tense and overwhelmed by the problems at work, but now I don't care too much. I just keep distance now. I just take better care of myself. So we see here how homeopathy and the prescription changes the overall sensitivity of the patient. So they're not so sensitive to stress factors they've been before. And you will see a bit more of that. She says, I've started noticing something. I have become more talkative than before, more open. I'm surprised by myself, really. Why? Because this is a person who's got problems to express themselves and their feelings. So they don't know how. So that's why it comes out in a strange way, weird way. And she says, just talk and I don't care. At the French class, I would never before dare to show knowledge or answer questions, but I noticed I was doing that during the last 2 classes. Unbelievable. And another thing, I went on a mountain trip with some people that I didn't like before, but this time I had really good time with them. There is no pain in the knee when she climbs. So you see, this is the person changes their attitude. They become less sensitive to the things they've been before. The things that used to hurt them before do not hurt them anymore. They're more objective. She becomes more open about her feelings. Her periods become more regular, less painful. I give her also calcineusin. This is my last prescription. And I haven't heard from her since, but 2 years after this consultation, she wrote to me, thank you. I don't know what you gave me, but I think you got the right one. She had a normal pregnancy. She became pregnant. She had a normal pregnancy, although she had the thalassemia minor and a healthy baby boy. So we see how homeopathy can change lives, how deep it affects the human being, how profound. And how a few drops change the entire being. Thanks for being with us. I would like to say thank you to Genoveva and the entire crew there for giving us the opportunity to talk about homeopathy and to bring more awareness, because where I live, the people don't know what it is. That's why I try to do more talks about it. And give awareness, of course, so people know and they can choose something that is really beneficial for them. It's very safe to use, and it's we are blessed to have homeopathy with us. And thank you one more time for joining us. Do you have any questions? Is there any? Can people ask questions?
This is a live webinar streamed on Facebook, so we don't
All
have
right.
any people asking questions, but it was an amazing, amazing webinar, Dana. The cases that you had showed us amazing results of homeopathy.
Yes. They show the
And-
depth of homeopathy that acts on every level of human being, how it affects the lives, the attitude of the person. The people become happier, more content in themselves. They've got desire to do things. That's another side of homeopathy that people are not aware of, because they come with symptoms and they want them resolved, the condition resolved, but they're not aware that there are more positive changes that homeopathy does.
Right. Amazing. I'd like to thank you once again, Dana and Ileana, and on behalf of Genoveva and Uta, I'd like to
Thank you
thank
for
all of
it.
you who've been here watching the live webinar, and I'd like to tell you that we have Obaid Hashmi tomorrow and with Dr. Chandak tomorrow. So we hope to see
Thank you
you
very
by
much.
about 4 o'clock
Hope to
GMT.
see you. All of
Thank
you
you,
stay
Dana.
healthy and optimistic.
Thank you.
Thank you.
Bye bye.
Bye.